for an average person who might feel maybe overwhelmed by skincare, because as you said, there is all kinds going on at the moment, TikTok, all these trends. What are the three most important things that they should focus on every day?
Knowing what your skin type is, doing those 3 simple steps. It doesn't really require a lot. Cleanse, and the most important thing you said.
I worry about this industry, and unfortunately in the aesthetic industry, sometimes people don't really set the expectations right, and unfortunately tend to maybe not overpromise, but...
Welcome to Consultation Room Podcast.
Welcome to season 2 finale of Consultation Room Podcast. Now, we have had a very long run this season. We have been recording for about 12 months, haven't we?
It's been a long year.
It has been a long year. We're so overdue a break. It's been so good. There's been a lot that's happened, but you know what? It's been actually really, really good. We have had a lot of growth, both in our professional lives, our personal lives. It's been great.
It has been. Yes. I hope our audience also enjoyed that 12 months of good education, good health education.
I think we gave out about 48 episodes. That's a lot of episodes if you think about it.
Yes.
That is a lot of it. And then we had a Christmas special, which was, oh my God, it was everything, wasn't it? It was, I think that's one thing I really enjoyed. Yes, we had a different setup. We were wearing all shimmery and all, we're all glitz and glam, and we're all set for Christmas. That was really good.
I love that.
Yes. What was your favorite part about season 2? Or should I say, what was your favorite topics that we discussed in season 2?
Wow, season 2. Where do I go from? As Trudy mentioned, Christmas specials. We gave you that games, that germs, that was good. Yeah, it was one of my favorite. What I loved about season 2, actually, let me just put it out there, was the different guests that we had. People sharing their story, and other health professionals sharing their knowledge.
Yes.
That's what I loved about season 2. And when it comes to my favorite topic, I don't even know. I can't even choose, I don't think I can choose.
Go on, you have to.
So much. Oh my God, there was so much. Because when we started off, your personal story about your fibroid story, I loved that. I loved how you were so personal, so vulnerable.
That was very personal.
Sharing your stories.
I felt naked talking about that. It's like I'm letting people see me naked,
Exactly. I loved it so much. And yeah, and the way we brought other guests as well, to share their fibroid story as well. So okay, that was good. What else? Amazing guest. All of you have been amazing.
Yes.
Do you know what? I like the cannabis topic.
Medicinal cannabis? When I tell you...
Sorry,
I don't want to put my business out there, but when I tell you that, that's all I'm going to say. It was a good episode. Period.
I love that episode. Because it was very educative.
It was.
Said, when it comes to medicinal cannabis, there's a lot of stigma about it.
Stigma, 100%.
Good to get that information out.
Yes.
Okay.
Eye-opening, wasn't it?
Away. Exactly. So I would say that was one of my favorite episodes. Yeah. What is your favorite?
That's true. Oh my God, my favorite. Do you know what? First of all, I have to say, you're right. All our guests brought in such a great vibe, and they almost brought in a sense of clean air, where we were learning something new. We were opening up. We were showing people that whatever you're going through is not, the only one going through that. There's people going through that. So you are not alone, kind of thing. So that was just very, very clean. Do you know what I mean? Just to bring that sort of that sense of, we're all in this together. So that was really good. And I think we had so many different guests. Some of our guests who were doctors became patients. So that was also very relatable, because then you get to see you get to see doctors from a different point of view where you're like, they're just normal people. And some of our guests who are, you know, making moves on social media and out there became very vulnerable by sharing some of their stories. So I feel like that was actually such a good, almost like a good conversation to just almost open up and just show people that you can talk about some of the things that's going, you know, that's going on in your life. And one of the guests that personally really touched me was Dawn, who was, you know, talking about her fibroids, which is something I could relate to because I just had my fibroids removed and I went through pretty much the same journey as she did, different journeys, but similar journey, I should say. And I think one thing she said is advocate for yourself, advocate for your health. And I think that stuck with me, that even now, whenever I'm thinking of calling my GP, I'm like psyching myself up before that call. Because I'm like, I need to, just when they say, oh, that's fine, you just need a blood test, I'm not just going to be okay with that. I need to push for more. Do you know what I mean?
Yeah.
So I feel like that was actually really, really good. But I liked our burning question episodes. I think we had some really interesting burning question episodes this season. Yes.
I feel like I've gotten all my burning questions out there. I don't even know what I'm going to ask.
I'm already thinking about season 3 because I'm ready. Like I feel like this little break is going to be good for us to just sort of like pick up on things as well. But I am ready for season 3 burning question because season 2 was good.
It was good.
Yes.
Burning questions were some of the burning questions you came up with. I was like, wow.
Yeah,
it was so good.
It was so good, wasn't it?
Do you know what I like?
Go on.
The candle one.
Yes.
Because now anytime like I see candles and stuff, I'm like,
you're like, keep away.
I keep looking at it like, okay, should I burn this candle or should I not? Like,
should I risk my life?
Honestly.
No, that is so
thank
good.
Thank you for that. Honestly, thank you
for
that
welcome. That's so good. And I think I have also to mention that one episode that really stood out to me was the sickle cell for, of course, obvious reasons, which is sickle cell is not something that is discussed enough.
Yes.
Part of the reason is because it affects the minority. So that was something that was very important for us to put up there, to have a conversation about, to bring someone who has been going through this and talk about what her journey has been and maybe just start a conversation. It's not just have this conversation, but start a conversation because it doesn't end with just that one episode. I feel like sickle cell is something that needs to be discussed even more. So that was also one of my really, really, I'd say favorite episodes because it resonated, if you know what I mean.
Yes. Oh, no. I really agree with you. Like, as you said, it really resonates because we have like people surrounding us who are going through the same thing.
So our families, our friends.
It was so good to have like our guest to join us to share her story. Check it out because you might be going through like a similar situation and it's something that could help you. So
that's true.
Thank you, Jalda, for joining us.
Yes, thank you, Jalda. No, that was really, really good. Every other episode was also really, really good. Yes. But what are you excited most about season 3?
Season 3. What am I excited about? Do you know what? I keep saying the guest. That's what makes it like really exciting for me.
Exciting,
like when the guests join us and they share their knowledge, they share their stories. Like I love it. So season 3, we expect to have more guests. So if you want to join us, if you're part of our audience and you want to join us and you want to be a guest, please contact us. We want to share your story. And if you're also a health professional where, you know, you want to join us so that we can like educate people about a particular topic, please get in contact with us as well. So I think season 3, I would like more guests. Yes. That's what I'm looking forward to. What about you?
I feel like season 3 should be more about guests. Season 1 and 2, we've talked about knowledge that we have, but we want other people to come in with different expertise to actually share some of these conversations and just share this knowledge with everyone. So definitely the guests. I'm very, very excited about. And I suppose that's a good way to end our season 2 by bringing in a guest to talk about something we have wanted to talk about for the longest time, but we just kept saying we need the right person to talk about this. And we found the right person, didn't we? I really hope you're excited for this episode because we are. we definitely are excited for this episode. Today, we're joined by Dr. Thuva from Dr.Derme, a leading voice in clinical dermatology and advanced aesthetics. He's here to break down the science, the trends, and the truth behind modern skin treatments. Welcome to the podcast, Dr. Thuva.
Yes, we appreciate you joining us.
Yes.
Thank you for having me.
We were going through your website and it looks amazing. Like, we saw so many different treatments that you offer. And one thing we came across was that, so you work in both clinical dermatology and cosmetic aesthetics. So just to dive right in, how do these two worlds like overlap in your practice?
No, that's quite interesting. Once again, thank you for having me on the show. I really appreciate you, and hopefully I can help you guys along with some things that are happening on the dermatology and aesthetics industry or market per se. And I think the intersectionality between dermatology and aesthetics is quite important, particularly because of the influx or the explosion of the aesthetic market at the moment. Obviously, you've got loads of influencers on Instagram, social media, TikTok and things talking about aesthetic treatments and people doing all sorts to themselves to achieve a better version of themselves. And I think that's important that you have someone who can provide a reliable source of information and administer these treatments in a safe manner. Because unfortunately, that's what we're dealing with at the moment. In the UK, unfortunately, of all the Western countries in the world, is the only place where it's a cowboy industry. Anyone could do anything in the back of the road, right? So it's really a worrying thing. And I think one of the other things to understand is that, unfortunately, compared to traditional NHS medicine, where there's clinical medicine, where you have evidence and pharmaceuticals, where there's a big body of evidence behind it, when it comes to the aesthetic or cosmetic treatments, there isn't usually that evidence behind it. It's usually by either practitioner experience or patient experience wanting something because they've done the research behind it. And so I think it's important that being able to fundamentally, as I say with all my education, is you have to know what you're treating first. It's not all pigmentation, right? There's different types of pigmentation and the course of that pigmentation is different, right? You can't chuck bleach at it and hope it works, right? It doesn't work like that, right?
That's very
I think that's where clinical dermatology experience comes into place. Understanding what is it in the first place that led to this pigmentation, and what's the process that's happening? Is that process currently ongoing? Has that process come to an end? And when I treat it with the ingredients that you usually treat to treat pigmentation, is it going to cause the problem in the first place to come back? Or is it going to get the patient the results they want? Because that's important. Because if it's going to cause a problem to come back, you might get rid of the pigmentation that was there before, but you're going to cause the problem to come back, and then you're going to get the pigmentation again. So I think that's where having the breadth of experience across not just aesthetics or cosmetic dermatology, but also clinical dermatology comes in its own merit and value.
No, that is very true. That's actually very true. And I'm glad you even mentioned something like pigmentation, because I'm sure this is the case. You'll deal with pigmentation differently for different skin. For instance, I am a Black person. The way hyperpigmentation will affect me is not the same way it will affect someone else. So that is actually... That's a really good point. Talking about hyperpigmentation, that's something that I worry about and I've had to deal with for a very long time. And I've had to try and find ways to sort of like deal with it and things like that. And I'm sure there's a lot of people doing the same. Now, for an average person who might feel maybe overwhelmed by skincare, because as you said, there is all kinds going on at the moment, TikTok, all these trends. What are the 3 most important things that they should focus on every day?
I think it's quite poignant that you point out skin of color, isn't it? Because that's my passion. Because as a person of color myself, unfortunately, both medical literature and Western medicine has has not done us justice. Because everything that we know about is based on Caucasian skin, how eczema presents in Caucasian skin, because it presents very differently in our skin, right? And there is now some theories to suggest there are fundamental physiological differences in our skin type between the different Fitzpatrick scale, which is the historical scale that we've used. But even if you look at it from different race points as well, there are differences in terms of how thick your skin is, how well it holds moisture, how easily it produces oil, how easily it reacts to an injury. And unfortunately, one of the reasons we have a problem with pigmentation is because, obviously, because of our ability to defend ourselves from the equatorial sunlight, we've evolved to obviously have darker pigmentation or to produce pigment very easily to avoid skin cancer, right?
Yeah.
But that means anything that hits your skin has the same reaction, right?
Yeah.
Acne spot, a cut, a bruise, overreacts, and it produces so much pigmentation, right?
Yeah.
Hence why we have the challenges we have with pigmentation compared to our counterparts, right? So that's fundamental. I think I digress, but that's my passion, because there's other things like keloids and things that we get that it's not existent.
That is a completely different topic.
There's not as big a burden in the other ethnicities, for example. But going back to the question you asked about what are the critical steps, I think I always go back to three critical things that I say. Number one, if you remember it this way, every day you go out, you're going to get pollutants from all the fumes from the cars, things in the air, which free radicals, which end up on your face, right? And those cause damage, right?
Yeah.
And then so what you're trying to do is to get all that dirt, the free radicals off your face. Right?
Yes.
And of course, sometimes it may be innate. It may be that your skin is producing too much oil if you've got, for example, oily skin type. And you want to get that off. So fundamentally, you need to cleanse your face, right?
Yeah.
Once, if not twice a day, ideally. So you get it off in the morning, get it off in the evening as well, right? So you cleanse your skin. Depending on what your needs are, it will be the cleanser that you use for it. And number two is obviously, it's good to hydrate your skin. Right, you don't, particularly if you've got dry skin or eczema-prone skin, you want to make sure that you're replacing that water so that your skin is replenished. Particularly in the winter months when the heater and the cold outside, it's a big fluctuation in temperature, so you'll get lots of water leaving your skin. So you want to replace that where you can. The only caveat is obviously if you've got oily skin, you want to be mindful about doing too much replacement.
Of course,
and of course. Point number three, which is always comes as a shock to my patients of color, is sun protection, right? If you're battling hyperpigmentation and you're spending thousands and hundreds of pounds on products to help your pigmentation, your best return on investment is sunblock, factor 50 every 2 hours. I will caveat that. Well, actually, I'll illustrate as to why that's important. There's an American study on Hispanic population which showed that if you use sun protection adequately for 12 weeks, you get 14% improvement in pigmentation just from adequate sun protection. So it's not a gimmick, it's not a con, it's not a sales thing, right? Don't quote me on those statistics, but roughly
12
around
weeks,
those numbers, right?
I'm going to test
12 weeks, 14% improvement in pigmentation, right? That's a big deal, right?
It
so that's
is.
number one. The caveat I will say is, remember, in the Western Hemisphere, we don't get enough sunlight. So all of us should be taking vitamin D, right? If you block our skin type with more sunblock, then you should definitely be taking vitamin D to obviously make sure that you're feeling well, because vitamin D is a critical component, or hormone, should we say, because it regulates your immunity, it regulates how well your mood is. So it's a critical component. We're all doing it anyway. But particularly if you're going to put sunblock on your skin, which is, I would advise strongly. So those are my three go-to, right?
Wow.
And then I think if you do that enough, if you just do those religiously, that's enough, right? You've made the biggest difference. If you want to go a step further, then obviously you can get an active research. My advice is always against doing too much, right? Don't change products. You have to stick with a product for 12 weeks unless you had a reaction. Otherwise, you're not going to see the benefits of it.
I'm just going to ask about something though, whilst we're still talking about this. You said that the first step is cleansing. What is your take on double cleansing? I mean, the girls are going a bit crazy sometimes. So what's your take on double cleansing? Is it necessary?
I think I'd go back, these are generic advice that applies to everything, but it really depends on context, right? Say you got acne and you got really oily skin, you may need to double cleanse. You may need to double cleanse either with the same cleanser, or the better alternative might be to use a salicylic acid cleanser, which will do that for you anyway, and treat the condition, or it may be that you use a cleanser and a polish to do the second stage of cleansing. Right? So it depends. It really depends on a case-by-case scenarios. I guess my only advice is just don't bleach your skin or leach your skin of everything, right? You don't want to have dry, irritated skin.
Strip it off.
Break your skin barrier, because that's a bigger problem to have than a bit of oiliness on your skin, right? Because once you've done the damage, it's hard to go back. So don't go experimenting all sorts of things and doing too much. Maybe double cleanse once at night or once a week or something like that. But it really depends on. You have to know what your skin's like to determine whether it's the right thing for you.
That's true.
Yes. Yes, definitely taking that home, like knowing what your skin type is, doing those 3 simple steps. You know, it doesn't really, it doesn't really require a lot. Cleanse, hydrate, and the most important thing you said, the
sunblock.
And we actually had an episode on that. So
we emphasize on this so much.
Yeah, especially people with our color skin, like we need it. We need it so much. So 100%. I'm so glad you emphasize on that. Like most people tend to forget it. So I'm glad you said you have to keep going as well. Consistency is key, you know. You can't just do it for 2 weeks and expect results. So you have to carry on.
And changing products as well, because I think that's the thing that happens now. People change products so often.
You see an influencer with a clear skin and then you think, oh, let me go try it. Like, you know, stick to what you know.
You'd be surprised. I get patients coming with a bag full of products into the clinic with broken skin barriers and no results and things like that. And then always the advice is 8 to 12 weeks minimum for you to see any result from any product.
Do you know what? I'm actually going to test that theory on the 12-week with sunblock, because I suffer from hyperpigmentation and I feel like that could work because I've been on holiday. I feel like when you're on holiday, you'll use sunscreen a bit more. Yes. So I come back and my skin is looking lovely. So I'm going to test that 12 weeks.
Yeah, I'm onto that as well. Brilliant. So you provide a lot of treatments, and there was one treatment that I was like, oh, what is this? It was very interesting. So that is the 8-point facelift. It sounds very high tech. Is it possible you could explain to us what it is and who it's for, and just like in simple terms so that we can understand?
No. So 8-point facelift is, as it says in the name, it's something that helps rejuvenate your face from 8 different angles per se. And the reason for that is based on a non-surgical facelift, i.e. without obviously the traditional facelift, which is plastic surgery, right? You have anesthetic, you're under the thing, and you have a surgeon open your face up and then pinch it all back so that you get nice firm skin again without any sagging or volume loss that you normally get, right? So typically, as we get older, what happens is the fat pads in our face become, the best way to describe it is if you imagine a balloon. As we get older, because of chronic sun exposure, because of not drinking enough water, smoking, being an athlete, for a marathon runner, unfortunately, it's the only time you'll see a doctor say don't do too much exercise. What happens is those fat pads break down, and it's like a balloon losing air. It gets deflated. As it deflates, what happens is everything with gravity drags down, right?
It does.
So one of the most prominent things you'll see in someone's face as they lose volume over time, as they get thing, is a sort of a gaunt experience of hollowing of the temples, right? So that's one place. The other one you see is that you'll get a sort of a line that goes from under the eye all the way across the cheek, because they get volume loss at the punctum of the cheeks in the middle here. This is where all the ligaments in the face which hold all the structures up connect in the middle here. So it's a very critical point on your face. And of course, once this goes, then you get lines around your nose, then you get lines around your mouth, and obviously you get gels formation as well, right? So what the 8-point facelift does is, without the use of plastic surgery, we're using hyaluronic acid dermal fillers. Now, usually there's a lot of stigma attached with dermal fillers and Botox, particularly in our communities, right? What you have to remember is that in the wrong hands, everything is poison. In the right hands, in the right quantity, right context, everything is helpful. So the difference, I think, is highlight is Botox and fillers. Is Botox is a way you use to relax the muscles to soften the lines, whereas fillers, we're replacing volume, right? We've lost volume, we've lost the fat. What we're trying to do is re-add that volume into your compartments of your face to get that rejuvenated, smile, refreshed look that we want, that we had once you were youthful at some point, right? So what we're doing there is using dermal fillers. Dermal fillers are basically made of hyaluronic acid. You might have heard a lot of hyaluronic acid on Instagram and things. Hyaluronic acid is the molecule that holds literally every cell in our skin together. So it's nothing artificial, nothing unknown to the body. It's what your body is made of, essentially. It's what holds all the skin together, and it's what holds moisture in our skin, right? It stops our skin from drying out because it can cause vast quantities of water per every molecule of hyaluronic acid. So this is artificially made into a gel form in a small little syringe that you have. Right. What we do is we inject that and to replace that volume. Now, the key when it comes to rejuvenation of the face or lifting your face, the 8-point facelift, is to work from top down. Because if you think about gravity, if you put volume at the bottom, it will sag. Because if too much volume at the bottom, it will sag, right? If you put volume at the top, what happens is you get a lifting effect. A crude analogy I used to describe this to get the true meaning of it behind is, you know, when you're putting up a tent, like a teepee tent, right?
Yes.
You put the sheet on the floor and then you use the tent pole in the middle and you put it up. And what happens? Everything gets taut, right?
Yeah.
Everything looks magical, right? You get the perfect form of the tent, right? So that's similar sort of thing we're doing with fillers here. What we do is we put the filler in here. What happens is all the tissues bounce back as they should be. So what happens? You get a lifting effect all the way from the bottom.
Right.
So that's why we work from the top. So 2 temples, and then the next area that we prefer is the cheek areas, because the cheek is where you get the pronounced effect. Yeah,
exactly.
It's literally like a tent, if you think about it. Yeah, and you've got the tent pole in the middle, which is where all the fat pads meet, and that's where the volume depletes. So the tent pole essentially shrinks as we get older, and all we're doing is putting that hyaluronic acid and pushing that tent pole back up. Right? And what happens is everything goes up and you get softening of the under eye lines, tear trough lines, you get softening of the nasolabial folds, you get softening of the marionette lines, and of course you get the pulling up of the jowls as well. You get a bit of a snatch jawline. Despite not being treating the hairline, you get a secondary effect from this. So that's where you go for natural results rather than injecting it directly into the jawline, directly into the nasolabial. So obviously, you still don't want to do too much because you don't want to make it look artificial. You don't want the pillar face that you see on Instagram, right? So it's about measuring things, right? And doing it in a strategic manner. Little goes a long way, and less is more is the key term that we go after here. And then you just work your way down. So temple, usually cheeks, then to the nasolabials, then to the marionette, then to the jawline, if we need to. Ideally, you want to avoid this as much as you can, but if you need to, you can replenish this as well. So that's usually the basics of the 8-point facelift in simple terms, if that helps to make it a little bit more easier to comprehend.
And very interesting.
I reckon that's what Kris Jenner got, because her face overnight and she looks like, you know, she's literally 50 years old. But that is actually quite interesting. It's something I feel like I would consider in a few years. Right now, I'm okay for now. I'll just age gracefully. But I think in a few years, I would definitely consider that. That's quite interesting. Well, you've mentioned, of course, there's the 8-point facelift, and then there's, of course, all these other treatments that we see and hear about all over Instagram, all over TikTok. So there's the salmon sperm treatments, there's the microneedling, laser injectables, all of these things. How can someone figure out which one of the treatments available is actually right for their skin, rather than just, of course, following the hype?
Yeah, I think it's a very important question. And I think the question comes down to choosing your practitioner wisely, right? I think
That's
experience counts. It's your face, right?
That's true.
You can have a cheap consultation or a free consultation, but you're going to get your money's worth for that consultation, right? It's going to be a sales pitch, right? Of what can I sell you to get my money back for that time, right? Or you pay for a consultation. It might be dear and expensive, but you're getting that person's in-depth experience, not just of cosmetics, but also dermatology and the full understanding that goes behind it, right? And then you get the plan that comes with it. Because understanding these things is important, right? And I go back to what I say. You have to understand why you've got to where you've got to, what your main concerns are, and what are the things that are going to work for your concerns? What are the things that have evidence for your concerns? Not just general rejuvenation, particularly your priority of concerns. You have to rank your concerns in order and address them in that order. So with the evidence-based treatment for that condition particularly, right? You can't just chuck microneedling chemical peels and polynucleotides and hope that your jawline goes bouncing back, because that's not going to happen. You're going to need some dermal fillers to bounce back your jawline, right? That's where I think I worry about this industry. And unfortunately, in the aesthetic industry, sometimes people don't really set the expectations right, and unfortunately tend to maybe not overpromise, but not give the true picture of what the expected results are.
That's true.
Right? I think it's my job as a doctor to tell you the worst case scenario of having this treatment and possibly the best case scenario as well, and the average outcome that you expect. Right? Average outcome, not the best outcome, not the miracle, the average outcome, because then
which is fair.
You're happy, I'm happy, right? Yeah, if we get an
100%.
amazing outcome, we're both ecstatic. If we get a rubbish outcome and for some reason it doesn't work for you, we're on the same page because we said, this is what's possible, but it may not work, right?
Yeah.
We're on the same page. We're not, you're not offended by you having wasted your money. I'm not offended because, you're unhappy. And I think that's the important, that trust and that experience goes a long way.
Exactly.
I think that's very important.
That. Yeah, and being honest with your patients, like they know exactly what they're expecting. Don't give them some unrealistic, goals and stuff. Yeah. I'm also glad you mentioned about how some people can, like, social media, you see an influencer where, they've got maybe they had a really bad skin and maybe pigmentation or some type of pigmentation. And then they say, I went for microneedling, I went for this. Then you see average people's, okay, maybe I need microneedling. You don't need it.
Half of the time it's filters that they have on, so...
Exactly.
Probably the most common myth I see in clinic is people using microneedling or selling microneedling for pigmentation, right? Microneedling is not designed to treat pigmentation. Microneedling is for rejuvenation of your skin, right? It's where the evidence lies. It's known as collagen induction therapy medically, right? It induces collagen production, right? It may subsequently, while you're having that, scatter some pigmentation, but it's not the best evidence-based treatment for pigmentation, right? It's a secondary, maybe even a tertiary outcome if you're lucky, right? But I should not be selling you that for pigmentation. That's a terrible way to go because you're not going to be happy because it is not going to help you with the pigmentation. Your skin may look lovely, you will have a beautiful glow, it will look great, but it's not going to address the primary concern, which is pigmentation.
Exactly.
Yeah, and that's where I think ethics comes into play because I used to do a lot of lasers. I don't do lasers at the moment, right? And I will tell all of my patients what the options are when it comes to lasers. And I say, unfortunately, I don't have that at the moment and it's not on offer. It may be the best treatment for you. Please go somewhere else and seek the treatment because that's what it's about, isn't it? You have to be honest, right? People appreciate honesty because they can trust you.
100%.
Exactly. Yeah. And some of these skin clinics, dermatology clinics, they tend to offer you things that you're not really comfortable with. I'm glad you're really honest with your patient and you tell them as it is. Someone advised me that I needed it, but I wasn't too comfortable with the advice and I was just scared of how small the needles are. If you don't need it, please don't go for it. That's what I normally say. Yeah. And make sure that the person advising you is credible as well. Moving on, so most of the time when it comes to skincare, dermatology, we mostly associate it with women. We know that men tend not to take care of their skin well. I mean, they do not care about their skin. So I know when it comes to skincare, they're not interested. But when it comes to treatment, have you noticed any shifts in male interest in aesthetics and cosmetic procedures?
I think that's a very good question that you're asking. It's very interesting because actually there's been an influx of men or persons masculine requesting these or exploring or investing in their skin, as I like to refer it, because I think they're starting to realize. I think some of it is from the social media influence, and I think sometimes I think that's a good thing because I think like you say, traditionally we men we're not great at looking after our skin or looking after ourselves full stop, isn't it? So I think it's good to see that it's not just aesthetic and beauty is not just for women, and there are men looking after their skin as fundamental as treating their acne earlier on so they don't suffer from scarring, but to even just making sure that they do the right small steps to prevent the signs of aging or to avoid or delay any significant signs of aging, so that it's a preventative measure rather than having too much treatment in the land, or even corrective treatments about rejuvenations, fillers, microneedling, and even peels as well for pigmentations and all sorts of things. There's a big influx of men seeking out these treatments.
Do you think social media has anything to do with that?
I think social media has a big role to do with that. I think everyone's on social media now, isn't it? From teenagers to everyone. So I think one, I think it's what our perception of what we expect in beauty, right? So definition of beauty, everyone is aspiring to a higher standard now. So everyone's perfecting things, everyone's picky about how they look and wants to present themselves well and is more observant of their skin, of the problems that may have. And I think that we're also more educated on the problems with skin, right? You know when it's acne, you have a suspicion when it's acne, but also skin cancer, right? People are hopefully, the education is helping us pick up these things more earlier than we would otherwise, because one of the common things when it comes to skin is obviously skin damage from sun, whether that's pre-cancerous damage or cancerous damage. You need to act early and pick up on that, right? So that's also important. So both of these things, hopefully, we're going around in the right trajectory. Hopefully, I hope it continues to improve without warping our expectations and going down the line of body dysmorphic disorder.
That's true.
It's a balance, isn't it? Everything is a fine balance.
100%. I mean, we've talked about a lot of treatments, and we know that, you know, dermatology or getting any sort of dermatological treatments is not cheap. So even the likes of, you know, these injectables we're talking about, it really is not cheap. So if someone actually wants just healthier and more confident skin and is on a limited budget, what treatments or routines would you say offer best value for money?
So if you were to talk in general principle, like I said, the 3 basic steps, right? What I say again is don't do everything. Don't do too many products, right? Keep it succinct and stick to it. Compliance is key, right? If you stick to it, good habit forming is critical and helps you really get the results you're after, right? Like I talked about, we want to keep your skin clean. We want to avoid any excess oil on your skin. We want to take all the dirt off after the end of the day when you've been busy out working, whatever whatever environment you may be working in. So cleanse twice a day, moisturize well, and sunblock. Those are the fundamental steps. And depending on what your other concerns may depend on what active that you may want to use. I would recommend no more, absolute maximum, 2 actives if you want, right? But always the key is to, in my opinion, particularly if you've got sensitive skin, is to do 1 product at a time. Start with a cleanser. Do it once a day. Get your skin used to it. Once after 2 days, maybe your skin's used to it, go to twice a day. See if that handles it well. Fair enough. Then introduce your second product, which is the moisturizer. Then introduce your third product after 2 days. So if you have a reaction, you know what's caused the problem.
You know what is,
right? Yeah. So when it comes to active, once you establish that basic routine, it's the same, but 2 weeks this time around, because actives tend to be a bit more harsher, right? So obviously the magical ingredient when it's thrown around when it comes to dermatology is, of course, retinol or retinoid or tretinoin, whichever form you want to talk about it. And I think it's important we understand that tretinoin is the medical drug that was invented 30, 40 years ago to treat acne, which has now subsequently, over the years, we've learned that helps with pigmentation and aging as well. But it's a potent drug, and the side effects of that are obviously irritation, redness, peeling. Now, what people have done, because obviously you can't sell it over the counter, is they've modified it into retinol, retinaldehyde, so you get all the different percentages that you see on the counter, which don't actually represent what the strength of tretinoin is, because it's a complete different drug or cosmetic ingredient now, because it's been modified. That's why you see different strengths in different people, and they don't add up because it's not the same. So retinol, you can get cosmeceutical retinol over the counter from the local shop, and you can try that, right? Usually what I say when you're starting something like that, or any active for that matter, is usually try it at nighttime, very little, tiny little droplet on your finger. Usually the areas that are sensitive and get likely to get irritated are the corners of your eyes, corners of your nose, corners of your lips. So either a bit of moisturizer or Vaseline, cover those areas so they don't get irritated, particularly if you've got sensitive skin. And then drop a bit of retinol or whichever active that you're putting on and dab it 4 places on your face, right? 2 dots on your forehead, 2 dots your cheeks, which are most of your big areas. Use 2 fingers, rub it all in. Right? Only ever at night time, because if you go out, put this on and go out in the daytime, the sun will burn you, right? Even if you're not prone to burning, your skin is now sensitized because of the active ingredient on your skin. It's likely to cause sunburn, right? Or at least irritate your skin. So only ever do this at night time to begin with, all right? Or for retinol, it's always only ever night time, right? And then what you do, you put a bit of moisturizer on top, because obviously the retinol, how it works, it dries out your skin and it helps exfoliate the skin, hence how it works for aging, pigmentation, acne, etc. right? And then you go to sleep. In the morning, again, you want to cleanse. Make sure you moisturize, because again, that retinol is going to dry out your skin, and then put sunblock as well to protect yourself, because you're using retinol, you're even more prone to sunburning than you previously were, right?
Sensitive
so you have
skin,
to wear sunblock while you're using retinol, for example. And then of course there are other ingredients like vitamin C. Again, if it's the only ingredient, use it at night time. Right? If you are using some other stuff, you can use it in the daytime, but remember, it's more likely to cause irritation if you put it on and go out in the sunlight. So it's best used at night time, right? And remember, you don't need to do actives every day. You can just have it every other day, once or twice a week, and that may be enough, particularly if you've got sensitive skin. That's just a brief spiel. But again, just mindful, no more than 4 products, because you're never going to stick to it for 12 weeks if you do more than that.
That's true. That's actually true.
That's quite educative, because I'm so glad you mentioned these things, going step by step, how, like, when you should apply it and how you should apply it, because sometimes I'm clueless when it comes to some of these products. When you said vitamin C, this was me applying it during the day.
You can do, and you can put sunscreen over it, but be aware that you might have a little bit of a tingle, you may be a bit more prone to burning and stuff, right? So it's best not to. You can do it. Retinol is absolutely no-go. Vitamin C, you can do it in the daytime, but it's best avoided if you can.
Okay. Honestly, the pointers you're given, I'm noting all of them down.
Taking all kinds of notes. Well, I hope everyone is as well, because this is good stuff. I feel like I can keep talking about skincare forever.
Thank you so much for these pointers, Dr. Thuva. Honestly, I love them so much. I think we've touched a bit on injectables and stuff. We've all seen that there've been like a rise in like unqualified injectors and DIY fillers out there. What risk do people need to be aware of when it comes to these?
I think that's a very important question. I think that, yes, unfortunately, in the UK, anyone can do filler injections, and to some degree with it, Bro-tox too, because you can get it off the black market. Recently, there's been an admission to hospital with someone who had Bro-tox imported from South Korea, injected into them with botulinism. What you have to remember is Bro-tox is poison, right? It's botulinum toxin.
Botulinum,
It's poison that's purified, but obviously it takes a certain quantity to have the botulinism, where you have the effects of slowing every muscle activity in your body down, right? So obviously we purify it and only inject it in a precise way, so it's controlled how it works, right? When you have untested, unpurified products and you're just winging it, that's when you result in botulism, right? And remember, Bro-tox injected can stop you breathing, right? So that's fatal, right? So don't mess around, right? Go to a professional, go to a medical clinic, a doctor or a nurse, ideally, if you can, because they're used to dealing with medical drugs and they're used to dealing with injectables and they understand the regulations around it. Now, having said that, I think filler is much more catastrophic as well, because filler, although it's just the stuff in your skin, if you inject it into a blood vessel, it can occlude that blood vessel. So if you think about it, a heart attack is an occlusion of your blood vessel in your heart, because it stops supplying to your blood vessels to the heart, which is the muscle that functions, right? A stroke is a blockage of blood flow in your brain. Right? So it's the same thing that's going to happen in your face. If you put the filler into one of the blood vessels in your face, it's going to occlude that blood vessels.
That's true.
Exactly. And the high risk areas typically are forehead, frowns, nose, nasolabial areas, but it can happen anywhere. And the thing is, what happens is when you block that vessel, there could be 2 ways it can happen. Either because the filler goes into the vessel and it causes no blood to come further out, then the rest of the tissue dies because there's no blood flow. There's no oxygen, so it just dies off. And you get essentially a gangrene. When you get an infection and things like that, that will happen, and it will just cause a catastrophic cosmetic outcome. Not long cosmetic, but obviously you get significant pain, it's going to be infected, it's going to be discharging. It's not what you're after, is it, when you're doing this kind of thing to yourself, right? What's worse is if that filler then embolizes, because in the blood vessel, and a little bit goes to the eye, or the blood vessel supplying your eye, it can make you blind. Right? Although there's not many of that in historical cases, it's a plausible thing that you have to be mindful. Having said, those are critical issues when it comes to people uneducated, or people who are not educated in fundamental anatomy and physiology as professionals, as the fundamental base of training, not a one-day course on anatomy off the road, but as part of their profession and have professional experience in it. That's important. I think number two is that when you have these filler treatments, again, it's about the ethics of it, right? Unfortunately, it's a private industry, right? You have to consider the ethics of the practitioner in front of you. Are they going to try flog you everything they can for £10 because they're charging £10? Or are they going to be controlled and measured because they're charging £100 and they are professional and ethical and going to treat you ethically as to what you need and stop you before you go down the streets of body dysmorphic disorder, right? Because they want an extra £10. Right? I think that's a critical component. And number three is, of course, the outcome, right? If you have an unsightly outcome, if it's lumpy or bumpy or it's led to any of the catastrophic events, how is someone who is not medically trained and licensed to inject hyalase to dissolve this going to be able to help you? They're not. They're going to send you to A&E. People in A&E don't necessarily know what they're dealing with or how to deal with it. Whereas an ethical practitioner who is a doctor, a nurse, pharmacist, will have these to hand because they care, because not necessarily maybe because of that's their outlook, but because there's a regulator regulating them as a professional, so they'll be scared of that at the least, right? And they're licensed to carry the hyalase because they're a medical professional and can administer treatment for you. And again, back to ethics, they will care, I will hope, more so about their reputation and you as a patient. Right? Because I don't want an unsatisfied patient, whatever the cause may be, right? Whether it's my fault, their fault, or disagreement of opinion, or differences of opinion, I will do my best to resolve that issue, right? Ultimately, if I carried out a treatment and there's a complication, it is my responsibility, right? Whether the money comes into it or not, right? Yeah, and what that may not be the perspective of everyone that's comes off the road and goes on a one-day filler course and starts injecting it. So ultimately, you're trusting someone with your face, and you have to ask: is this the person you want to trust with your face? Right? Every day, everything you do, the first thing someone notices is your face.
Yeah, so true.
Huh? Do you want to skimp out and have a catastrophic event? Take the risk. It's up to you. If you want to, go for it. But I wouldn't.
Yeah, I wouldn't either. Come on, your face is the first thing people look at. So powerful. I love this ending to our season 2. Dr. Thuva, such a good episode. So insightful. Like everything that you've said, I've been like mentally taking notes. I'm like, yep, I need to do this. I need to do this. And also like educating other people as well, because there are certain things you said, I'm like, wow. Like people just go with the trend and not actually seek for like good advice and stuff. So thank you so much. Honestly, we appreciate your time and your effort. Like everything that you've said here, I hope everybody enjoyed it as much as we did. You've given us so many perspectives into things like to think about, and you've given us clarity as well. And if anybody enjoyed as much as we did and they want to discuss further treatment, please do check out some details that we're going to link. Visit Dr. Derme as well. But we put all of Dr. Thuva's details in our video. Do contact him. I know I'm going to be contacting you as well. There's certain things I need to discuss with you.
Excellent. Thank you for having me. Appreciate that.
That's actually been really good. Thank you so much for joining us and for sharing all that knowledge. I don't know about yourself, but I've learned a lot.
I have
just within the hour.
When I tell you I was taking mental notes, I'm not even
And I hope you can join us for season 3 because I feel like there's so much I could still talk about because dermatology is something that is it's for me it's like something just so important. So I would love to keep talking about this. And I think it's also a conversation that people need to have because people don't realize skin is the largest organ, isn't it? So
it is,
you
the
have
first line of defense.
Exactly. Yes. And you don't look after it as well as you should, there's definitely something wrong there. But no, this has been really good. Thank you so much for joining us.
Thank you, guys. No, happy to help. Happy to help. Anyway, no worries. Take care, guys.
So that was a perfect end to season 2. I hope you enjoyed it. We enjoyed it. Honestly, Yes, season 2 has been long and we need our rest, don't we? So we're gonna go for a little break, just a little break. Don't like whilst we're on a break, please do check out our other videos, other audio, so that you don't miss us too much, okay?
Exactly.
But we won't be gone for a long time.
Yes.
Season 3, we're coming in very hot.
Mm-hmm.
Coming in. And when I say hot, we're bringing in a lot of things. Stay tuned and do not miss us too much, but we'll be here
100%.
for season 3 with a lot of knowledge, a lot of stories. So please stay tuned.
Yes. So season 3 is going to be a big one. And when we begin season 3, we have a big surprise. So do check out our posts. I'm just going to give it, Steph. I'm going to give it away. We're going to have a giveaway, a massive giveaway when we begin, when we start season 3. So please, I don't want you guys to miss out on this. So check out what you need to do to get entered into this competition and to win this giveaway. But this is going to be at the beginning of season 3. So please check out our posts, keep listening, send it to your families, your mothers, your aunties, your uncles.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week. Stay safe, stay healthy, and stay blessed.